improving. Welcome back to another episode of the Ask Dr. Renee Show for the Black Doctors Speak podcast, proudly sponsored by the African American Wellness Project, an organization committed to improving health outcomes for Black families through education, empowerment, and access. Today, we are recognizing World AIDS Day with a conversation that could quite literally save lives. We are talking about HIV prevention, care, and the urgent need to protect the health of Black women who continue to be disproportionately affected by this epidemic. And I am honored to have a true powerhouse in this work joining me. Tracy Jones, the Southern Bureau Chief for the AIDS Healthcare Foundation, has dedicated more than 26 years of her life to HIV and STI prevention and advocacy and community impact. Her journey began in human resources, but her purpose found her when she joined a groundbreaking partnership between Case Western Reserve and Akron University to study HIV prevention. HIV prevention messaging for African American women. That moment ignited a lifelong commitment. Since then, Tracy has led HIV education for women and teens, directed more than a dozen prevention programs for the city of Cleveland, served in leadership roles at the AIDS Task Force of Greater Cleveland, including CEO, and helped shepherd the organization into a transformative partnership with AHF, which is the AIDS Healthcare Foundation. Today, as a Senior Director and National Director of Mobilization Campaigns for AHF, Tracy plays a critical role in ensuring that more than 100 million people around the world have access to cutting-edge HIV care, testing, and advocacy. Her leadership is felt not just nationally, but globally. She is also the co-founder of the Beyond Identities Community Center for Youth, a published contributor on minority health issues, and the proud mom of a very active 13-year-old Aiden. Tracy's work sits at the intersection of equity, access, community empowerment, and life-saving healthcare. And she brings an incredible wealth of knowledge to this conversation. So let's dive in as we honor World AIDS Day, uplift Black women's health, and highlight the vital work being done to end the HIV epidemic. So here is our guest. Hi, hold on.
Hey, hello, how are you?
Great.
Thank you so much for having me.
Oh, no, this was wonderful. I was so glad to do it. I think I can tell my audience I've actually met Tracy several times in person because I have a very dear friend that works for AHF, and so I've met her in person. She's just as fabulous as she's going to be in this interview. So.
Well, thank you.
You're welcome. So, Tracy, for anyone who may not be familiar, can you share what makes AHF the world's largest HIV/AIDS nonprofit and how that global leadership shows up in communities here in the United States?
Absolutely. AHF, which stands for AIDS Healthcare Foundation, is the largest provider of HIV services on the globe. And, when you say that, you think to yourself, wow, that's pretty amazing. It is an amazing organization that currently now is in 50 countries and 17 states. So its footprint in providing services to people living with and affected by HIV and AIDS is humongous at this point. We have several business lines that we use and dedicate to people living with HIV and AIDS, to include what we call our out-of-the-closet thrift stores. And those stores enable us to do wellness testing for STIs and to include HIV. And also, a lot of them encompass pharmacies that are available to anyone for anything, including your blood pressure medicines all the way up to HIV medications. In addition to those, we actually provide healthy housing. So we've got housing properties all over the country that are low income housing that tend to be repurposed hotels. So the rent for them is, in most areas, the lowest you can get. So it enables people to focus on their care and taking care of themselves while being housed in a place that is safe and dedicated to making sure that they stay housed and off the streets. And a lot of times we do have folks that are coming to us from homelessness. We also do. Oh, I'm sorry.
No, you keep going. That's fine.
Oh, we also have what we call our healthy food program, which in some of our cities, we actually have small grocery stores. And in a lot of the other facilities, we have what we call food pantries. We are dedicated to making sure the legacy organizations in community exist. So we have a business line called the Federation, which actually has now 13 organizations which might have closed their doors that are a part of the Federation, that have their own identities that serve all over the country. As well as we have what we call our public health program, PhD. And we have facilities which are either rolling STI clinics or also HIV/AIDS units in community that are dispersed all over the country, so that you can get on the van to get testing or get information, and that van actually goes out to community. And we have a pharmacy program. In addition to the one that I was telling you, we have freestanding pharmacies, 70 at this point, all over the country.
Wow. Okay, so I think you covered like a whole bunch in that. I was going to ask you about what innovations or approaches, but I think that the thrift store is quite an innovation. That is really cool. And I've actually been to the one here in Chicago. And that was, that's pretty, I think that is neat. You can shop, but you could also get tested at the same time. Why not?
And it's a wonderful, as the kids would say, it's a wonderful cover game, because nobody knows what you're there for. You can go in and shop and, get called and get tested and waiting on your results. You can get you a cute dress. So
right.
The purpose of them is really to lower the temperature around making sure that you take care of yourself, so you can get a lot of necessities done in a one-stop shop.
And also, I think you also did cover how AHF ensures that marginalized communities, especially Black women, receive equitable access to HIV testing, prevention, and treatment because of the pharmacies that are everywhere and the clinics that are everywhere and in every kind of a neighborhood. Especially in marginalized communities. Like I've been to a clinic in the neighborhood too, because one of my friends was working there. So it's you covered a lot, but we have to talk about the purpose of today. So the purpose of World AIDS Day is so important, but some people only think of it as a remembrance day. But can you talk about its broader purpose and why it remains relevant today?
Absolutely. And thank you for the question. I think sometimes because, lots of generations, now we're talking generations of people that have been infected and affected by HIV and AIDS, we tend to think of loss. But we now have survivors that are well into their 60s who are surviving and thriving with HIV and AIDS. And the recognition of their survival is important, to be able to acknowledge that you were potentially a person who was diagnosed when there were really no treatments, and to see the evolution of treatments, and to be able to, in some cases, go back to work. There are many of our patients that actually are part of the workforce and who are, have families. We have many of our patients that have children. So the recognition to having an illness that was really regarded as something that you should really be looking at your finances for the termination of life, to being at a point where you're thinking about buying a house and how to live with your family and how to take care of yourself and, how to be of service to others, is the commemoration of this particular day, which we call World AIDS Day.
And so how does World AIDS Day help us refocus on issues like equity, stigma reduction, and expanding access to care?
I'm going to answer that in a couple ways. And one of the things that comes to mind is we still are challenged by our view of sex and sexuality as it comes to women. And, I still have patients that tell me stories that after their diagnosis, they really didn't see themselves finding love, or if they did find love, they were concerned that they might be in a relationship that was abusive, because you get to disregard someone if you don't value them or know that they have worth. So saying that to say that recognizing that everybody deserves, to be loved. And HIV is a sexually transmitted disease like many other sexually transmitted diseases. To be able to say on World AIDS Day, we're going to acknowledge that it is a STI, and that it is something that many, many people are living with, that it does not deserve the stigma that we give it, which sometimes alienates people from family, alienates people from their loved ones, still to this day, that there's still lots of our patients that live in silence. And to acknowledge that if you are a sexually active female, you can take what we call PrEP. So it's pre-exposure prophylaxis that allows women to control how and when they choose to protect themselves around HIV and AIDS.
So Black women are disproportionately affected, as we all know, and we know the numbers are clear. Black women continue to be affected by HIV in larger numbers than their counterparts. Tracy, can you break down what those trends look like today?
Yeah, sometimes we forget that Black people are only 13% of the population. So, I was actually having a conversation with a European American gentleman at a hotel, outside of a hotel, a few weeks ago. Pissed me off. But he was willing to say to me, he says, he asked me what I did for a living, which always can be a bit of a challenge for some. And he's like, that, the disease is affecting your community. You all are the folks that are the most infected. And I was like, sir, proportionally, that's correct. But that's not the whole story.
Right.
And what makes that challenging is people tend to think that, all the Black women got all the AIDS or HIV. And the reality is it is a proportional number. But that proportion, because we are a closed community, Black women tend to have sex with Black men. And if the communities are closed, the risk is higher. That's it. It's not because of the kind of sex we have, and I don't think white women have any more anal sex than Black women, although Black women like anal sex. There's nothing wrong with that. But proportionally, because we are such a small part of the population, our risk is so much higher, which means we must protect ourselves at all times.
So, and you might have just answered this. Why do you believe Black women are still experiencing higher rates of new diagnosis despite the advances in HIV prevention? Because you just mentioned PrEP, which I've talked about many a time on my show about PrEP. I've had pharmacists, I've had, all sorts of people talking about PrEP. And I worked with an agency to help get the word out about a study about PrEP, and it blew me away. I had to post on TikTok and everything, and it blew me away how many people still had no idea. And these are not uneducated people. These are educated people.
I mean, I'm going to answer that in a couple different ways. I still think that Black women, we give over the discussion and the operation, if you will, of sex to our partners in ways that can be very detrimental to us. If our partners often say, I don't want to use condoms, and we are not educated enough to know that things like PrEP exist, we often are acquiescing to our own, our own infections, and not just HIV, gonorrhea, syphilis, chlamydia, right. Count one.
The rest of the STIs and STDs. Exactly.
At the top of every list. I think women don't discuss that with other women, and we're going to have a real conversation. We don't discuss it with other women, that you have to take responsibility for HIV transmission. 2, Black women want to get pregnant. Let's keep it 100. Black women want families. We are at a point where we are the most educated population there is in this country. Bar none. That's Black women. But then when we turn around after we've done all of that work, we're now looking for a partner. And sometimes we're just not the most discerning because we want that family that we have grown up imagining our whole lives. And we don't ask enough questions, or we don't do enough to make sure that the other person that we're going to engage with doesn't have a transmitted disease. I think that those two things go to the top of my list, to be honest.
I remember when I was in medical school, I told my mom, I was like, Mommy, the list keeps getting longer. I have to ask him, is he single? I have to ask him, does anybody else think that you are attached to them? I have to ask him, does he have any kids? Have you ever slept with men? Have you been tested for HIV? I was like, Mommy, the list just keeps getting longer and longer. This is awful.
That's true.
Not true. But I was also a lot younger than I call them grown-up conversations. I was like, I'm big girl now. I can have big girl conversations. But when I was in med school, of course, I was less than 25, I think. And so I was like, I don't know about all this. This is too much. And was so envious of my friends who got married prior to 30 and didn't have to necessarily go into all of that because, you know, a lot of this has just been, you know, just keeps getting tacked on.
Yeah. But we find ourselves, you know, as a person who's been married before twice, you know, you start a marriage, you didn't have to ask all them questions, but that second one, you know.
Yeah, exactly. Yeah.
Playing field may be very different. Very different. And so I think sometimes, I mean, I still hear from young people, and my son who was 13 in your introduction is now 18. I'm like, you need to have real discussions with people. You know, he's grown up in the work, so it's much easier for him. He says, but Mom, people think it's over. They think they don't have to worry about HIV.
He's right. And then because so many people are living so long with it, I think that also makes people, and actually that gets into this next one maybe, is that maybe one of the misconceptions that still exist about HIV risk among Black women that we need to challenge is that, you know, people like Magic Johnson and others that, and I mean, not just Magic, but just regular people. I know a lot of people that are living long, lovely lives and they're HIV positive. And so people are like, okay, well, they think of it as just, you know, no big deal.
Yeah. I mean, and I you know better than anybody. Like as your patients age, as my patients age, the spontaneous brain disorders we're seeing are off the Richter. They're wonderful medications, but they're medications,
right?
You know, and so
side effects, and you don't know, you know, and I mean, you have to risk has to outweigh the benefits, and so
yeah, and you know, when you are of childbearing age, you've got to weigh a whole bunch of things around that, and so I've had lots of patients now that are just like, you know, Tracy, I'm just tired of taking the pills, and you're like, you have to take the pills, but that's the other challenge when you've got a chronic illness. People don't understand. Yeah, the medications are wonderful, but it's the rest of your life.
Yeah. I had the pleasure of meeting and interviewing, and actually I walked in the AIDS Atlanta walk with Idea Broadbent, and she's been on the show, and that was just so devastating when she died, because she was one of the people that was that came on the show a couple times, and she talked about the her numbers were so low.
Undetectable.
Thank you. My words. Yes. So that was interesting learning about that from her. I was like, oh, okay. And, you know, explaining that. And, you know, and a lot of people, you know, the thing is, that's why we say it's good to test, because if you find out early, you can start treatment early. And then there is possibility that you could get down to less than having a handful of medication, down to maybe it's just 1 or 2 pills a day. And it's not so much. So that's why it's, you know, early detection across the board, every disease that I talk about. It is so important that we find out early for reasons like that, so that you can live long, but you don't have to take, you know, back in the day in 1980 something, you know, these people were on just as much medication as my 78-year-old father, who takes God only knows how many pills a day, but you know what I mean?
Yeah.
But
And now we're on the precipice. We actually have injections that last, upwards of 3 months, that were upwards of 6 months, and there will be a yearly injection soon.
yeah. And same thing with PrEP. PrEP, was a pill, and now PrEP you can have once they're going. That's what one of the studies was about, was taking 1 year. I think it was an injection once a year or something for PrEP. So yeah, so things are happening, which tells you that it's still around, because it blows me away. COVID happened and people were like, "Oh, COVID," and we're like, "Yeah, but HIV is still there too." So
didn't go nowhere.
Didn't go nowhere. No.
So when COVID was with us before, it just wasn't that particular COVID. So
right. It was the new, yeah, exactly. New. When we talk about disparities, it's not just about behavior; it's about the structures in place. So, what are some of the biggest structural barriers that continue to put Black women at higher risk?
Information, I think, is one of the biggest ones. Is that, I think getting people to just do routine care is getting harder and harder. We got better because people were doing preventive care, especially if you were a woman who was a childbearing years. We tend to be more cautious because we're trying to protect ourselves. But life got busy, and then COVID happened, and then now it's just trying to get people to go and see the primary care doctor, me included. It's a struggle, So I think information became deathly silent. One of the things I love about AHF is that we put up billboards. We still do.
Yeah.
And we're still tapping on your head to say, hey, you're at risk. So, and in addition to that, I still think there's a bit of stigma when women walk in the door and say, your doctor says, hey, do you have any risk? And she's like, oh, no, I'm married, And I don't think sometimes doctors always say, yeah, you're still at risk. You don't know what your partner's doing.
No, they don't. And you're right.
And we don't want to offend, right?
Right.
As medical professionals, you don't want to offend. But this was years ago, and I'm a wonderful general practitioner that I used to see. She was like, we've known each other for years. She was like, are you having sex with men, women, or both? And I was like, thank you for the question.
Right.
So I think sometimes reminding medical professionals that you've got to go there with your patients, especially Black women, because we're demure. There's just some things we just don't do or talk about. And the bottom line is, sometimes you just got to ask the question. And my girlfriends know, don't show up to my house without, if you want to wine with me, we got to talk about something. It's got to be beneficial. What are the things that stop you? And that we ignore the signs. His phone went off at 3:00 in the morning. He done came and showed up to you and gave you them chlamydia pills. If you got risk for this, you got risk for that. You know? So sometimes being able, I know the women in my family were very transparent about saying that there were risks involved in relationships because people step out, right? And I think that discussion has gotten muted. I think we talk about cheating as it relates to he has another woman per se, but we're not having that conversation around the risks that come with introducing somebody else into a relationship.
Yeah. And we had somebody come and speak to our the Doctors Association here, and they asked, and it was interesting because a lot of doctors said they just don't have time. And that's true. If you work for one of those big conglomerates, and you're not in private practice, then you only have, they want you to see, I'm not joking, 30
minutes. Yeah.
You might only have 10, 15 minutes, and you got to get through her questions. Because, if you're, you got to get through the woman's questions that she has for you, because most of us Black women do come in and it's written down and we ready. You got to get through those, but then you have to cover what you need to cover too. And, we got to do the diabetes and the hypertension and, all of that stuff too. And so it's just really difficult with time constraints to get all of that in. And then honestly, because I worked with an OBGYN when I was studying to become a doctor for several years. And it was so interesting how those ladies would just open up and just their all, but that takes time. Like,
It takes time.
they would talk for a long time, and she was very kind to listen to them, which always would mean that she was late, to the next one, which she was my doctor too. And so I always scheduled my appointments first in the morning, because then I knew, look, I'm not going to mess up your time, because I talk to her all the time. We texting, but then I know that I'm not going to be sitting there waiting all day. But yeah, so, and patients get mad, but I'm like, but you would want her to spend that time with you too. So therefore, don't get mad that she spent a little extra time with the person before you, and now you had to wait.
Yeah.
And so I think that time is really a crunch, which is why it's so important for us to get this information out, and for us not to get misinformation. But it's so important for social media and the billboards and the, all the places. Unfortunately, I've said it many times, those PrEP commercials, when they first came out, they really messed up, because they literally clearly stated that you had to be a person that was born with male parts, basically.
Yes.
Like, literally, basically, that's what it said. Even though there was one trans woman in one of the commercials that was on one of the shows I watched, that I used to watch. And so I paid attention because I knew her from that, but I was like, wait a minute, what did they just say? So it confused me. And so then now when they tried to flip the script, I'm like, okay, but you lost a lot of people in that. And I felt like the original commercials, they also were so elusive that we didn't quite know what they were talking about and what they were trying to sell. And so I think that that's where they fell off. And so now they're trying to, run it back and pull everyone forward. And so, it's a little difficult, but I think you're right. Information is key. And it's getting it out there, and people paying attention. And so and unfortunately, I also know that many physicians don't know about PrEP either. So when you bring it up to your doctor, I've had several people come to me because they knew that I knew. And they said, well, I asked my doctor and she said, you don't need that. Or she said, what are you talking about? Or he said, and I was like, oh God. So
come to AHF. We giving it out like candy.
Yeah. So
because we want, and to your point that you were making earlier, like our earlier studies around women in PrEP were horrendous. But, we didn't necessarily do them on women in the US either.
Right.
That was the first problem. And then even when we got to a point with saying, okay, now we're going to open it up and it's available to everyone, we, like you said, did a bad job because there was already so much blood in the water, if you will, with Black men that they were like, nope, bad on your bones, bad on your liver, bad on your blood. So some of that translated over that people were like, but the medications themselves got better. So the medications we were using for PrEP got better.
Right.
But none of that dialogue came across. We lost all of that. So now we got to go back and, and then you there's so much, like you said, misinformation about how to take PrEP and how to take, you got to take it correctly for it to be beneficial to you. And I think sometimes that kind of information has kind of got lost as it relates to women, not men, but women.
Women. Yeah.
Yes.
Because you're right. I know lots of men who, oh yeah, I'm on PrEP. But then you ask women and they're like, I'm like, but you're single and you're having sex. Like you. And so, yeah. And then just like the question you said about, I'm not at risk. No, actually. So, and like I said, I do a lot of work with you guys. And so Marcella taught me about, I'm HIV Possible.
Okay. Yes.
And everyone's HIV possible.
Yes, they are.
And so I was like, I did talk about this with a group of young girls that were college students and high school students. And I think their mouths just dropped. And they were like, what? I was like, yeah.
HIV possible.
Yeah, right. They're like, what? And I was like, yeah. So, and I think that just like we had to go through that rough waters with the cervical cancer vaccine, I think we're just going to have to muddy through some rough waters with PrEP as well. And hopefully by year 2027, maybe we can get it so that everyone's on board. Because I think honestly, like especially if your children are about to go away to school, and be out of your presence and be living on their own. They might be doing some things, and this would be very helpful to them and beneficial. Just like I said, just like the cervical cancer vaccine, this could be very beneficial to those young women. Because I can't remember the ages, but what's the ages that are, supposedly most at risk with the Black women?
13 to 24.
See? So therefore, did you hear her say 13? Okay. 13. So yeah, so we need to definitely, granted, there is HIV being spread in the nursing homes too. So please do not
absolutely
that your elderly population is out of the woods.
And what really makes that bad, and you know better than anybody, because there's so many illnesses that are germane to the geriatric population, to stack on HIV, which can be very, very detrimental to your immune system, it's just not a good recipe.
Not at all.
It's not.
Recipe for disaster.
Yes, ma'am.
Yeah. So, and I know that population, especially in the year of 2025, that population, they weren't so much on the condom bandwagon. So that's why AHF is so important, because you can go in and get free condoms. You can go get free testing. You can go, you can get everything. You heard her at the top of the show. One top shop. They'll take care of your whole body, not just HIV. Ma'am. They will take care of everything. And so I think that it's really important that you do the research to figure out where they are, because they don't make money a barrier, which is the other thing that is so critical, as we know in our community. Insurance can be an issue and money can be an issue, transportation, getting to and from, and all these things. But they try to make sure that they remove all of the barriers so that everyone can get help. And it's equal across the board, men and women. Just please, what is the website so that they can figure out where there is a clinic maybe near them or pharmacy?
Absolutely. AHF.org.
Easy peasy, lemon squeezy. I'm going to put that on the screen right now, because we need to put that up there. And actually we'll put it so it's a ticker, and then, but I think, oh, there it is right there. So we'll just leave that there. But yeah, AHF.org, and I'll make sure it's in the notes too, but please make certain that you visit AHF.org and you find this information, because this information can be beneficial, if not to you, because maybe you do have insurance, but maybe to somebody else. Or maybe when you're in between jobs, you need this information and you need to make sure that you're getting checked out. So make sure that you please, you guys can go together and get tested together. They also will send you tests. It's just all sorts of ways to get tested and to make sure that you know your status. December 1st is one day out of the year, but just like all the other months and days we have when it comes to these different health diseases and different issues, it's something that some people deal with every single day. But it's something that we need to, as long as we are going to be procreating human beings, we need to think about and talk about very regularly. Especially, you heard her say 13 to 24. So therefore, I learned maybe about 10 years ago that sex ed was being removed from the schools, which is crazy. But if that's the case, then mom and dad, you're going to have these tough conversations so that you can protect your children, because it's amazing to sit and talk to kids. I mentor a lot of kids, and it's amazing to listen to them say that they had no idea. And I'm like, how did you not have a clue? But if no one told you and you're getting your information from your friend or from the internet, not everything on the internet is true. And your friend may not know what they're talking about either. So that's why it's important for them to understand and know and get this information. Talk to your doctor about PrEP. And if your doctor doesn't know, then you need to go call it, contact AHF and talk to them. Your doctor is probably a fabulous physician. It's just that there's a lot of stuff they have to know and cover, and they just didn't know. But please get the information. So lastly, I want to say, what is one message you want Black women to hear loud and clear this World AIDS Day?
The thing I always try to convey to Black women is you are in control of your own body and health. Because I think sometimes we outsource it. We outsource it to our children because we become incubators to get our kids here. We outsource it to our partners because, oh my God, I've got to have sex when he wants, where he wants, how he wants, because he's going to leave me. You are the determining factor of where and how you have sex and with whom. And if you can put that at the front of your mind when you're making decisions, sometimes those decisions can be different. I don't feel like it today. I am more than an incubator. I am somebody that's worth loving. So I'm not going to put myself at risk. Yeah, you are the decider of your healthcare.
Thank you so much for joining us for this important World AIDS Day conversation. And a huge thank you to Tracy Jones and the AIDS Healthcare Foundation for the incredible work they continue to do to protect and uplift our communities, especially Black women. I hope today's episode gave you the information, encouragement, and power you need to take control of your health and to share these resources with the people you love. If you enjoyed this conversation, make sure you subscribe so you never miss an episode of the Ask Dr. Renee Show right here on the Black Doctor Speak podcast. And don't forget, you can also watch us now, the Ask Dr. Renee Show on Bond TV streaming network, and where we highlight stories, experts, and conversations that help you live the life you deserve. Where have you heard that before? Be sure to follow me across all social media platforms at Ask Dr. Renee and share this episode with someone who needs to hear it. Thank you for listening and watching. Stay well, stay informed, and as my mentor, Dr. Michael Lenore, who's also the president of the African American Wellness Project, always says, health is your greatest asset. Protect it.